Thank you so much for joining us on this day of Children's Week, Physical Health. And we are ecstatic to have you join us and share the work underway this session for you. You had a phenomenal committee hearing yesterday where you talked about and advocated for a number of very important issues near and dear to us. We'd love to have you share.
Well, thank you so much. I appreciate you guys supporting me and testifying yesterday as well. That hearing is really just the beginning. There are so many issues that I think this is just a great way to start it off, and we're already talking about after these issues pass and some of the other fantastic bills that we've got going on this session, how we're going to build on that momentum for next session.
Wonderful. If you could share a few of the bills underway right now and how you want folks to support. And then we'd also love to hear a little bit about your other hat, your other role in our state and the great work that you do when you're not in session, because it is also tied to children's health.
Absolutely. Well, of course, AB 189 was heard yesterday for presumptive eligibility for pregnant women. And then we're going to be amending to include AB 193 as well. So we'll be expanding Medicaid coverage for pregnant women to 200%. And we're also going to expand postpartum care to 1 year versus the 60 days that it currently is. One of the other options that we're asking the state to also do is that for legal immigrants that are waiting, they don't have to wait that 5 years to be on Medicaid for pregnancy. So that will be a huge help for many of our immigrant women as well. I have another bill that I haven't received the language yet, so I don't have the bill number. It's going to be with the Clark County Children's Mental Health Consortium. They had approached Assemblywoman Monk about carrying a bill, and unfortunately she wasn't able to be here this session, so I'm going to carry it instead. And basically that's going to take the consortium and sort of clarify the organization on how the Clark County versus Washoe versus the rural and the state, how they all work together. And I think that will definitely make sure that we're not duplicating services, we're streamlining information and just make things a little bit smoother on how we can help children that have mental health issues and working with the school districts. A couple other maternal child health bills that we've got going on is Claire Thompson. She has one that's with a maternal mortality review. They're cleaning up a little bit of language in that. As you probably know, Danielle Monroe Moreno ran a bill last session to get that started. So that's a huge accomplishment for the state. Very excited that we have that. And then Assemblywoman Danielle Monroe Moreno and Assemblywoman, I was going to say Shannon Bilbert Axelrod. Sorry. No, it is Chandra Armstrong Summers. They both have some maternal child care bills as well, including registering certified nurse midwives and doulas being approved by Medicaid. So that is so great, so exciting that women really have those birthing options. So looking forward to seeing those bills. Of course, yesterday you probably heard Assemblywoman Krasner's bill on testing for moms on Medicaid. Really excited about that. I have to say, I've known Dr. Slotnick for many years and he is fabulous. So it's really good to see him. It's been several years since I've seen him. As you mentioned, my other job, my other hat, I work with Foundation for Positively Kids. And so our mission is to provide healthcare to children, but we really emphasize that child that has a special healthcare needs. We have 2 clinics, one of which sees probably 90% of the kids that come through Child Haven. So they're foster kids. They've got many issues. And so we're helping catch them up on immunizations, make sure if they have an ear infection, we've got medicine for them. If there's chronic illness like diabetes or asthma, we're working to get that maintained and taken care of. We also do early intervention, which I look forward to expanding in next session as well. Early intervention, for those who might not know, are for children who have developmental or intellectual delays, and it's from birth to 3 years. And so they receive physical therapy, speech therapy, maybe audiology, nutrition, just a wide variety of services that they can receive. And they receive it up to 3 years. And at that point, they move into the school district. And so We're looking to expand that to possibly 5 years. And also we're talking about making it that if a woman knows she's pregnant with a baby that may have a developmental disability, that baby is already on the wait list for early intervention services. So as soon as that baby's born, we can get that child into services right away. And that'd be for a child that we know is going to be born with maybe Down syndrome. They obviously are going to need some assistance, so let's get them in sooner rather than later. Those are some of the things we're working on, and we're working hard and miss all of you being in the building.
And Assemblywoman Gorelow, I just wanted to mention too, that last part that you mentioned, that was a conversation that came out of one of the, from a Strong Start parent ambassador. So it's great to see that how parents can be involved and come up with some great ideas to increase access to care.
Yes, I mentioned at that time, I love that idea, and I still do, and I look forward to bringing it to the legislature probably next session.
Awesome. I'd like to open it up to questions before I ask a litany of others. I am in such support of the great work that you're doing, so and want to showcase that. But are there other questions?
I will ask a question. So how do you overall, how do you think the session is going so far? Are you like pleased with some of the discussion and comments, surprised? What's your feeling of it up there?
Well, first, we miss the advocates and the lobbyists. I definitely do. Because there's so much education around the issues the advocates and lobbyists give us that it's really invaluable. So I'm hoping that we can open up the building as soon as possible. But of course, we want to do it in a safe manner for everybody. So as soon as that's able to happen, we will definitely do that. I think the session's going well because it is quiet, is a little on the slower side, it feels, but on the bright side, I do get to do a lot more work. I'm able to access even my own colleagues a little bit more and talk to them about the issues and get better discussions. So in that respect, that is going very well. You know, I'm very pleased so far with the session. Still waiting for some bill language, but other than that, it's going very well.
I have a question, if that's okay. My question relates to the amazing number of bills relating to moms and babies. You know, this is the second legislative session. Last session was the first where there was a majority women. It made national news. Do you think that some of that momentum is attributable to having so much representation at the legislature?
Absolutely. You know, presumptive eligibility especially, it was something I'd worked on for years prior to being in the legislature, and it really was the issue that made me passionate about running for office. When I would have those conversations when it was a male-dominant body, they didn't go very far. And so now that we are women-led, I definitely think that that has changed the topics and the feel about those topics as well. They're definitely more positive conversations, and I definitely feel that that's one of the reasons why we're able to accomplish these issues.
And certainly I would think encouraging women to get involved, stay involved. You know, there's so many levels where you can be involved and really make that change. And, you know, I look to you all and just say, look at the change just in, you know, a few years, right?
Absolutely. Like many of these issues, they've been around for years. They just didn't get the momentum and the conversation about them. And now it's just such a much different feel in the building. And it's exciting to have these conversations and really talk in depth about these issues. So I'm very excited to be a part of it.
Awesome. Thank you.
As the session continues to evolve and folks see and understand the value of the policy that you're bringing forward, how can they support or get engaged with you or support the efforts in the way that you are spearheading?
They can always email my office and share their stories. I love stories and I love to have them shared in hearings especially. I've had a couple people on my Facebook page mention stories about how one was a gentleman who was a community outreach worker, and he had to research the deaths of stillborn babies. And he said in so many cases, these moms never had prenatal care. I've known him for years and had no idea that this was part of his history and his experience. And so I really want to reach out to him and others like that to have those experiences and stories told and shared, because they are so impactful, especially when we're talking about women and children's healthcare issues. And so if there is someone out there who had, whether it's a good story or a bad story, maybe they had excellent prenatal care and they were high risk and they were able to have a healthy baby, those stories are just as important as the unfortunate ones as well. So both stories are greatly appreciated. Please reach out. We would love to talk more. And if you're uncomfortable at a hearing, because some people, it makes them nervous to testify at a hearing. It can be a little overwhelming, but write a letter. That works too. Give their representative a call and say, hey, this is really important to me and this is why. And so they can spread the word. And the more we're out there and more we're talking, the more this is going to be moving forward.
Assemblywoman Gorelow. Hey, it's Shar.
Hi.
How are you?
And you're the one I was talking about with that language. I'm hoping today.
I'm crossing my fingers. But, you know, it's interesting. I saw the bill on the presumptive eligibility, and I was so excited to see you bring that forward, because when I was pregnant with my first son, my ex-husband had just gotten out of the Marine Corps. We had moved to New York, and I found out right after we got to New York that I was pregnant, and I was 5 months pregnant before I had my first prenatal appointment, because it took so long to get that Medicaid process going. Really, I mean, I was fortunate. He's fine. He was obviously well fed because he was 9 pounds at birth, but that could have gone so many different ways, especially because at the end of the pregnancy, there were some complications right there at the end where, like, he and I both almost did not make it. So, you know, that early care, and not just the early care, but quality care, because one of the problems with that pregnancy was that I had undiagnosed gestational diabetes because they had a mix up in the lab. So, so those kinds of things really, it's not just about that presumptive eligibility, but also the quality of care that individuals are getting, whether it's Medicaid or private insurance.
Absolutely. And thank you for sharing your story. We should be talking for the Senate hearing. It's very important, because when you told me you had a 9 pound plus baby, I had already known that you were probably gestational diabetic. Mm-hmm. A lot of times we hear stories about these big babies and we think, oh, isn't that so cute? They're so big. And, you know, we kind of joke about it, but that's a serious condition too. We have our really tiny babies, which are a problem, but our big babies are a problem too. And especially mom being gestational diabetic, that can cause you some long-term issues as well. And if you were in Nevada, probably you would not have been seen at all, because at 5 months, you would have been considered high risk. And a lot of the doctors here would not have seen you because they would have been afraid of the liability. And so that's an issue that we've had to deal with in Nevada as well. That particular issue has gotten better, but I want to make sure that we're doing better as well. As I say, you know more, do more. So we're going to do better.
And just on the other about the language, we actually talked about it in this coffee chat yesterday morning, or not the coffee chat, but the second part, the 8 o'clock, I guess. So I am very excited to see that bill finally come to fruition.
I am too. And I did hear from them yesterday. There were 2 of them that should come out today. So I'm just going to be standing in my doorway waiting for it. We have to get these all out by, introduced by, I believe, Monday is our deadline. And so I'm basically going to sign and turn them in so we can get them introduced.
Awesome. Are there other questions, thoughts, or comments while we have the phenomenal Assemblywoman, Ms. Gorelow? Well, I want to personally thank you for your time this morning, your advocacy and leadership. We look forward to supporting this very important policy underway and are thankful for the ways in which you are not only taking action in your work outside of session, but taking what you glean there and making our whole state better through policy as a result of the work that you're doing every day for children and families. So thank you.
Well, thank you. And I want to thank everyone for being here this morning. And hopefully when this pandemic subsides, we can all get together because it's so great to see friends, new and old. And I really look forward to getting together, whether it's in session or out of session, and continuing these conversations and moving our bar forward.
And celebrating.
Yes.